Yourself, Nidhi.
Hi, can you hear me?
Yes, now it's fine.
The number of patients who recovered from coronavirus in India has crossed about 2 lakh now, and the recovery rate in the country stands at 54%. Recently, the recoveries moved past active cases as well. How do you read these recovery numbers in India? What do these tell you?
Maria can give you some specific. I mean, it's always great news when we see people recovering from COVID-19. The recovery numbers tend to lag behind because they're very often not reported officially, and it takes time for us to catch up. What we do see in those numbers is a group of patients who are very lucky in many ways to have got through the disease, some people who've been critically ill, but also people who need continued support, people who need, potentially some who've been critically ill, need follow-up. This is, at the critical stage, this disease takes an awful lot out of people. They need follow-up medical care. They may need life support, income support, and certainly the last thing they need is stigma. And we've seen situations where, again, patients finding it hard to reintegrate because of stigmatization. So it's very important that we see the survivors of COVID as people who've been through a lot, people who suffered, and people who deserve the care and acceptance of communities as they return. COVID survivors are a symbol of hope for all our communities, and we hope that in India they will provide that symbol for further efforts to control the disease. We're also obviously seeing some interesting and useful therapies emerging, and trying to ensure that patients who need it get medical oxygen, get access to the drugs and standards of care that they deserve. So yes, it's good to see that. There's nothing particular you can read into recovery rates, but I'll ask Maria to maybe speak about that in terms of epidemiologically what it means.
Thanks, Mike. Yes, so we are seeing a large number of recoveries, and we expect to continue to see that. If we look at the breakdown of severity that many countries are seeing amongst the reported cases, there will be recoveries. But what we're trying to do through our clinical networks and through our collaborations with clinicians and medical professionals all over the world is really to understand what recovery looks like. So even in mild patients, who didn't necessarily require hospitalization for care, they are still seeing some lingering effects. And we're really learning what those lingering effects look like. We're hearing people feeling quite tired for quite some time, still feeling a little bit out of breath if they need to walk upstairs or walk up hills. And so we need to better understand that so that we know what kind of long-term care are required. Those individuals who have had severe disease, who've been either intubated or on ventilation and required more advanced care, they may have some longer or more severe effects going forward. But again, we're working with the clinicians to find out what does rehabilitation look like amongst those that have recovered. But as Mike has said, the fact that we're seeing so many recoveries is a sign of hope. We want to ensure that anyone who is infected with COVID-19 receives the care that they need to prevent them from advancing to severe disease, but no matter what level of disease they have, to ensure that they're cared for even after they recover and they leave hospital.
Next question comes from National Geographic.